Oh, hi.
Hi. May I help you?
I'm Liam. I'm the new infection prevention specialist. It's Jenny, right?
Yeah.
Okay, cool. Jenny, did you get the chance to take a look at Mrs. Hendrix's urinary catheter? I just see a couple of issues.
Okay, what's wrong with it?
Well, the drainage bag is touching the floor, and the tube is looped.
Yeah, it probably just slipped.
Okay. Also, I didn't see the insertion date on the collection bag. Is it notated in the patient's medical records?
Did I not note that? It was inserted a week ago. Sorry about that. I can get right on it.
Okay, cool. One last thing
Hey,
that...
sorry, I got held up. Jenny, this is Liam, our new infection prevention specialist.
We've met.
Yeah, hey Maria. Hey, so Jenny, I know you're aware, but I just want to give you a reminder to not let urine build up in the tube because it can lead to UTIs.
Got it. The next time you come, it's gonna be perfect.
Awesome. Thank you very much.
Sure.
We're actually all done.
Oh, wow. Okay. Thanks.
See ya.
Thanks, Jenny. Thanks, Mrs. Hendricks.
Great job, Liam. Communication is crucial in our line of work, and you're really nailing it. I really appreciate how you take the time to explain why we do certain things.
Thanks. I feel like I gotta do it sometimes, to really remind patients and caregivers why infection prevention matters. It may take a little bit more time, but I feel like the impact can be huge.
Oh, I agree. And you really can't afford to cut corners when it comes to infection prevention.
Exactly. Taking a few extra minutes to follow proper practices can really make a difference.
Yeah.
Next up,
Yeah, let's go.
let's go.
So how do you normally go about rounding an indwelling urinary catheter?
Checklist, of course. I got this one memorized.
Great.
Oh, yeah. So the first thing we'll do is check to make sure that the tubing and collection bag aren't resting on the floor, which they are not. And then we need to also make sure that the bag is below the level of the bladder.
It is.
And then we need to make sure that the flow from the catheter to the bag remains unobstructed. So, Elena, I just need to move the blankets slightly so I can check some tubing. Is that okay?
Looks good.
Yeah, I agree. But I didn't notice the insertion date on the bag. Is it in the patient's medical records?
Yes, it was inserted a week ago.
Okay, but the bag looks really full.
Yeah, it's definitely more than 3/4 full. Not good.
Yeah.
You know what? Let's take another look at the securement device.
Okay. Yeah, the catheter is not well secured.
No, it probably slipped under the blankets. Elena, are you experiencing any discomfort? It's because the catheter needs to be secured properly to stop it from tugging back and forth and to prevent any irritation to the urethra.
So we'll let your nurse know and she'll take care of it for you. The last thing we need to check is to make sure the closed system is maintained and that the seal at the junction of the tubing and the catheter remains intact, which looks all good.
Oh, Amy, perfect timing.
Hi.
I was just doing rounds with Liam and we need your help. Did you get a chance to meet Liam yet?
Hi. Yeah, we've met. How can I help you?
Hey, Amy. Do you mind if I show you a few things real quick?
Sure.
Okay, so first is that the catheter is not well secured and it's causing Elena some pain. And then the bag is a little bit too full. So do you mind if we get those things cleared up so we can avoid any unnecessary complications?
Definitely. And I'm really sorry to hear about that, Elena. Please, always let me know if you're experiencing any pain or discomfort. I'm here to help. And I'll handle that, Liam.
Great, thank you. Just a few quick questions for you. Have you been doing perineal care at least once a day?
Yes, you can check in the patient's log every 10 to 14 hours.
Okay, great. And then lastly, what's the reason for leaving the indwelling urinary catheter in place?
It's just short term. The doctor wants to keep an eye on intake and output.
Okay, great. Yeah, I think we're all good here. So, thanks, Amy. Thank you, Elena. Have a good rest of your day.
Thank you.
You're welcome.
Bye, Elena. Excellent. Very well done.
Thank you. I really appreciate you doing this. It's been very helpful.
Of course. Like I said, I'm here to help you integrate smoothly.
Thanks.
You got it.